Substance Misuse and Abuse, Environmental and Cultural Factors by Braden, Berrett, Matt Barker, and Amy Crabtree. The cultural environment. Media. Media gratifies substance abuse. It makes it look like it's neutral, relaxing, fun, or an attractive habit. It's all beautiful people, as you can see. It undermines the healthy futures of young people, and it leads teens to drink and use drugs recreationally, thinking, hey, it's okay. That's what the media tells us. Family support. Meaningful family time, like having dinner together, increase self-esteem, decrease social pressures, family council time. All these things with support improve decision-making and communication skills. If you're talking to your kids about what they see in the media, and just having a great rapport with your children will be a positive effect for them as they get older, especially into high school. When there's lack of family support, such as poor role models in your parents, it can run in families, substance abuse, lack of communication and education in the home, increased risk for abuse and neglect, poor behaviors and self-control, and poor academic performance. What does the role of peers play? Peers can play a role in one's physical, mental, and emotional development. A peer's influence is the most important predictor of adolescent substance abuse. According to the National Center on Addiction and Substance Abuse, 90% of addicts started abusing drugs before the age of 18. And peers helps fulfill a need for social acceptance. They looks cool. The cyclical nature of substance abuse. There's an increased risk for substance use in children with one or both parents who are users. Addicted parents can influence children and just because of what they are doing. People who experience some traumatic events such as physical or sexual abuse, loss of a parent, or divorce at a young age, or a victim of a violent crime can all produce cyclical natures, and then genetics play a role in the vulnerability to drug dependence.
All right, the cultural environment, the legal and political system, how they influence those who abuse substances, narcotics, and alcohol. They're very involved. So the government at a local, state, national level are very involved in supporting and helping those with these addictions. You can go to the samsha.gov website, and they actually take care of mental illness also there. But the government's very much involved in helping these people overcome their issues. Also, Utah, it's very known to have very strict laws regarding legal and illegal substances, and a big one is alcohol. We have some of the strictest laws to help influence those that need help, or to help others not cause accidents. Culture environment potential barriers that we've noticed is the big one is the public stigma. So a lot of people may view these people as dangerous, unpredictable, irresponsible, like they're criminals because they get involved with drugs and selling drugs. They're lazy, weak, worthless, and hopeless. This public stigma is something that's around, and so the people that are dealing with these addictions can label themselves, so it's called self-stigma, and they believe that they're dangerous, unpredictable, they believe that they're irresponsible and worthless people, and so they are discouraged from seeking help, basically, so they kind of just get stuck. Also, there's barriers for those who have just been in jail. So when they get out of jail, they have some trouble securing successful employment. They lose the right to vote and participate in politics, and they lose access to social support and educational opportunities because of their addiction. International scope. So we've seen some of the risks that we've seen is that people that abuse and are addicted to drugs is job insecurity. They have unstable housing within the home. They have economic hardships because they have trouble making money to support their children or their spouse or even themselves. And we've noticed that within these homes, when the parents are abusing drugs, they may mistreat the children within the home, and those children can sometimes get into drugs also as well. Substance abuse and shunning. So some articles we found that in Muslim families believe that substance abuse is frowned upon, sinful, and taboo. And those who abuse substances perceive they are shunned by their religious affiliation. So we kind of see that across the board when it comes to religion and groups. Health disparities among their depending on the socioeconomic status. In our research, we found that low income and socioeconomic deprivation are connected to an increase of occurrence of overdose-related deaths. There's more alcohol-related deaths, and there's also a decreased resilience to disease and sickness because they have a lack of resources such as healthcare, and they may. We're good. And they may also, when they're abusing drugs, especially those who use needles, get diseases such as HIV and hepatitis. We forgot to add that in there, but. Some of the health disparities are with race and ethnicity. We've noticed with African Americans, there's racial discrimination, which increases alcohol and other substance abuse to cope with the stress that comes from discrimination. And they're less likely to quit than drinking than Caucasians. American Indians or Alaskan Natives, they have a lack of cultural connections within the community, so they're hard to connect with those around them. They tend to be within their own population. They don't interact with other cultures. So they see a lot of harassment. They have mixed identity, and they suffer with the negative stereotypes. And Latinos who abuse drugs have poor health outcomes due to lack of resources as well. They're less likely to drink alcohol than other ethnic groups, but once they start, they tend to be binge drinkers, so they drink large amounts of alcohol when they begin drinking. All right, religion. So religion kind of plays both sides. I'll start with the negative. So when people are part of a religion and they tend to get addicted to narcotics, alcohol, or other substances, they tend to feel guilt and shame because they don't want to be looked down upon, because when you're in a religion, you feel like you're expected to be, righteous and all that. So they tend to feel guilt and shame. They carry that with them. This also discourages them from seeking help because they don't want to be judged, and that's the negative stigma due to the religious culture they're in. But the positives of religion is that when they are practicing the religion, it actually leads to better coping and recovery from addictions they may be having. And that's because they promote an increased self-esteem, they promote faith in oneself and something greater than themselves, and it also promotes forgiveness, which attacks the shame and guilt that comes from the negative aspects of it. And they also, a lot of successful recovery programs are based around spirituality and involving their lives with the higher power.
Okay, so health disparities with gender. Among males are more prone to abuse alcohol and marijuana. Greater than 18 years old, they are more likely to have a substance dependence than women. Ages 12 to 17 years of age, substance abuse is the same as females. With females are more likely to abuse prescription drugs. And the same goes with them, that they are 12 to 17 years old, the abuse is the same. Health disparities among geographical location with substance abuse. It's more prevalent in non-metropolitan areas than metropolitan. And the reason why this is because of low education, poverty, unemployment, high-risk behaviors, and isolation. With telehealth and telemedicine, this would be very supportive and very positive for this area if they had this available to them, because it would help them reach to rural patients and also provide the resources and education related to substances like alcohol, cocaine, marijuana, or whatever addiction they are suffering from that's related to substance abuse. According to biases, implicit biases, this is a subconscious level. They face in the healthcare and criminal justice system subconsciously due to race, culture, and appearance. And treatment interventions are affected because of this implicit bias. So, for example, coming into a hospital, if a patient comes into the ER, we judge them subconsciously because of their appearance, because of the color of their skin, and because of their culture. Explicit biases, this is done consciously. People can be rude, make judgmental comments. For example, an alcoholic father who spends too much time drinking, doesn't spend a lot of time with their family. So a lot of people will gossip about that and make judgments without even getting to know the person of why they became addicted to alcohol. And with the international scope for health disparities with these, crime is a huge one. The Mexican drug war is big, especially with the drug cartel. Violence can occur due to substance abuse and cartels. Third world countries face this because of the lack of resources, poverty, lack of education, and specifically one area is Ghana, Africa. Personally, I communicated with my cousin, Mitchell Blanchard, and he was able to tell me that alcohol abuse is more prevalent in men, especially in smaller communities in Ghana. And these are our references. Thank you for listening.